Thank you for choosing SolRx Pharmacy Review Program. The purpose of our videos is to better prepare you for your qualifying Part 2 exam. You will now have the opportunity to watch a presentation which will provide you an orientation of the exams. Secondly, some videos that will showcase some scenarios, followed with a quick review by a pharmacist. Wishing you all the best for your exams.
Welcome to SolRx Pharmacy Review Program. In this CD, we are going to run through the orientation for the Pharmacy Technician Qualifying Exam 2, also known as OSPE. SolRx Pharmacy Review Program is operated by SolRx Inc., which was started in 2009 to serve the pharmacist and pharmacy technician. Today, it is Canada's premier pharmacy review program and is 100% owned and operated by Canadian registered pharmacists. It's very important for you to be aware that SolRx Inc. and its review programs are neither related to nor endorsed by Pharmacy Examining Board of Canada. It's important that you understand that SolRx Inc. just conducts the review programs and does not provide certification. A little bit about myself. My name is Bhavin Desai. I'm a registered pharmacist, certified diabetic educator, and hold a master's degree in business administration. I'm licensed in Ontario since 2008. My co-author for this book is Vipul Shah. He's also a pharmacist and holds a master's in business administration. He is licensed in Ontario since 2008. So first of all, I would like to welcome all of you. Welcome to the future. This is an exciting time for the pharmacy practice. The pharmacy technicians are finally getting recognized for all the things that they have to offer to the profession. There are so many changes that are happening, and the expanded scope of practice for the pharmacy technicians is something which is very, very exciting and promising. So what exactly is now the difference between a pharmacy assistant and a pharmacy technician? The pharmacy technician is now a protected title, and it is an offense for anyone else to use that. All other non-registered dispensary personnel must use a separate title but cannot use a pharmacy technician. What exactly can they do? They can basically perform the technical aspects of controlled act of dispensing, which means they may release the final product after completing a final check prior to release for all prescriptions. This is something which was till now a prerogative only available to the pharmacist. Now the pharmacy technicians can do this part as well. Of course, they need to keep in mind that they need to ensure collaboration with the pharmacist to make sure that before any prescription goes out, the pharmacist has looked at the therapeutic appropriateness of the prescription. It does not matter whether it is a repeat or new, but the pharmacist must sign for the therapeutic appropriateness. Pharmacy technicians are also now able to accept verbal prescriptions. However, there is an exception. They cannot accept a verbal order for narcotics and controlled substances. Very soon, they will also be able to complete the transfers between the pharmacies. Let us try to know a little bit more about the OSPE exams conducted by the Pharmacy Examining Board of Canada. OSPE stands for Objective Structured Performance Examination. The exam consists of two different types of stations, interactive and non-interactive stations. The interactive includes prescription stations, OTC recommendation stations or over-the-counter recommendation stations, doctor or healthcare stations, management stations, and demonstration of devices. In this kind of stations, there is someone that you're all the time interacting with and trying to solve their problem or completing a task that is requested of you. The non-interactive stations include information retrieval. You may be given references like CPS, pediatric dosage form, Martindale, and you might be expected to retrieve a certain information. Dispense checking. It includes two parts: dispense checking of prescription drugs, as well as of part 2 would include blister packs. In both the cases, you need to make sure two things. One, is the order being filled exactly as it was prescribed? And secondly, is the drug right, and it is in the right vial, and is it having the right label? Same with blister packs. There are 4 columns and 7 rows. You need to make sure that in each of the boxes the product is right. Then there is non-sterile compounding. In this kind of stations, you might be required to perform a small calculation and then quickly compound the product. Before you show up at the exam, it's a very good idea to run through good manufacturing practices. What are the best practices of how to make a non-sterile compounding? It is possible that what you currently practice in the pharmacy may not be the best practice, and there is a scope of improvement. Make sure you run through the best practices for compounding non-sterile products. Finally, there will be questions based on sterile compounding videos. All you need to do is look at the videos and answer the questions. To be able to well prepared for them, you need to know more about compounding. Sterile compounding, which we'll be covering shortly. The examination may consist of 8 to 10 scored stations. Might be a couple of, or maybe 1 or 2 pre-test stations and few rest stations. Each station is set up in a separate area and are usually in a different room, and it's furnished with materials and references that is required to complete the tasks. Each station consists of 1 or more short tasks. Make sure before you enter the station you read the instruction for the candidate. This will help you to perform in the station better because you exactly know what you're supposed to be doing. Just in case if you miss out on reading that instruction note fully or even partially, do not worry. The same note is present inside the station. Remember, when you complete one station and move to the next station, before the next station starts, there are about 2 minutes. So you will have enough time to look at the instruction for the next station. So how are the interactive stations conducted? Each interactive station is 6 minutes long. The station starts with a buzzer that indicates that you need to enter. If there is a patient, standardized client, or a healthcare professional, they will enter after 30 seconds. It is possible that the healthcare professional might be sitting inside the room already. At 4.5 minutes, there will be a warning bell to let you know it's time to wrap up. There are only 90 seconds remaining. Finally, there will be a buzzer at 6 minutes. No matter what you say or do after that, it does not count. The standardized patient or the standardized healthcare professional will walk out at the 6th minute even if you are in the middle of saying something. Of course, the stations conduct references and you can look at them anytime. However, keep in mind that you have only 6 minutes. And as I explained before, there are 2 minutes between stations and you need to utilize this to read the instruction for the candidate for the task in the following station. The non-interactive stations require you to respond in writing certain tasks. It may include identifying errors, which is probably in dispense checking, or there are problems on prescriptions, or someone has requested a drug information and you need to provide that information. There will be a station that will require you to perform a technical procedure, for example in non-sterile compounding, and there will be an assessor who would be evaluating your performance. Just keep in mind that there will be no interaction. Finally, there is one video station. You will have the opportunity to watch a video clip of a procedure. For example, it could be a sterile compounding video clip. Based on the video clips, you would need to answer the questions. The total OSPE exam is about 4 hours. It starts with admission and registration, followed with a brief to the candidate about the schedule and the procedures. When the exam begins, it's usually the first half is about 60 minutes. After that, there is a break. This break is essentially for assessors and actors. Step 5, the exam will begin after the break, and once again there will be another 60 minutes or so. This is the second half of the exam. Remember, all the 60 minutes you will not be part of a scored station. You would have a rest station where you would be able to go to the washroom or eat or drink water. Once the exam is completed, you need to complete the feedback questionnaire, sign out. It may take another some time. Just make sure it's the most important exam and you are not late. Be there quite ahead of time. Preparing for the OSPE exam. Preparing for OSPE. Before you embark on what needs to be prepared for OSPE, a good idea would be to run through the list of NAPRA competency on which the pharmacy technicians are evaluated. Once you have a look at it, it will give you a fairly good idea about what is expected of you, what is the entry-level competency expected by NAPRA, on what different parameters, and how you should be well prepared. How do you prepare for the interactive stations? Some of the basic understanding, if you have it, it will make it a lot easier for you to perform in the interactive stations. The first thing, let's take the case of allergy. As a pharmacy technician, it's important that you understand the difference between allergy, intolerance, and side effects. Unfortunately, in the pharmacy, what happens is everything is listed under one category, allergies. So whenever a customer says, I have allergy, it's important for you to ask, what happened when you took this medication last time? And thereby classify if it is allergy, if it is intolerance, or side effect. If it is allergy, is it a mild allergy or is it an anaphylactic reaction? This understanding about the severity of allergy is very, very important. There are a lot of prescriptions that may come. Some of them are related to antibiotics or antivirals. Certain things you need to keep in mind. Many antibiotics are used for multiple types of infections. The dose and duration of the therapy may vary depending on the type of infections. And in children, the dose is dependent on weight in many cases. And in some other categories of drugs, the dose could be dependent on age. What this means for you as a pharmacy technician who is taking the prescription for the patient is that whenever you come across a prescription like this, make sure if it is a child, you ask for weight and age. Age is usually there, but make sure you don't miss out on weight. If it is antibiotic or antiviral, make sure you ask the reason for the prescription. What is the disease which is being treated, or what kind of infection is being treated? This will help you and the pharmacist to understand if the prescription is appropriate or not. Whenever you come across a prescription for children, make sure to ask for their age and weight. Many drugs could be given by age, for example Twinrix, or by weight like EpiPen. There are certain drugs which are not indicated below certain age, and therefore age and weight of children may make a critical difference in your performance in the interactive stations. Whenever you see a prescription for a woman in the age group of 18 to 48, it's very important to ask if she could be pregnant or breastfeeding. And the same applies for any over-the-counter recommendation where the patient is a female 18 to 48. Once you identify that the patient is pregnant, make sure you also identify the trimester. Dispensing errors. Unfortunately, they are the reality of pharmacy practice. No matter how hard we try, still there is always a chance of dispensing error, and in some cases they do happen. How do you handle a case of dispensing error? The first thing is to investigate the error. Do not jump to conclusions. Make sure you understand and you have identified if there was a dispensing error or not. If yes, what was the extent of dispensing error, and also ensure the patient's safety. Always remember to put patient first. It is our responsibility to take care of our patient, and we have to ensure their safety, and it is our first priority. The worst thing that you can do is to try to cover up for a mistake. So if there is a dispensing error has happened, make sure you stand up and accept the mistakes. Learn from the mistake. Try to put the process in place that will avoid the errors in the future. Remember, whenever there is a dispensing error, it's important that the patient be therapeutically evaluated, and hence it's very important for you to involve the pharmacist in this matter as soon as possible. Information gathering, key to success in interactive stations. If you really want to succeed in interactive stations, the key is to gather proper and full medical history. How do you gather full medical history? So generally, candidates tend to follow a format or a structure. This enables them to ask relevant questions in a logical, particular order that ensures that they gather full medical history. When you have all the relevant information about the patient, it reduces the chances of missing out something very important that you should know, and hence you would be able to avoid any error and catch any drug related problems, or actually the pharmacist can catch any drug related problems. Another thing you must keep in mind is that you must be very well versed with your references. If you are well versed with your references, it will help you two ways. One, you will be able to complete the station in time because it's a 6-minute station. You don't have a lot of time. So it's very important to run through the references very quickly. Secondly, Once you have been able to find out the relevant information, it basically ensures your success in the station. Some of the references that you might want to very well versed with include references like CPS, therapeutic choices for minor ailments, Martindale's, and there are some others. Preparing for the non-interactive stations. In the non-interactive stations, the book contains various sections. Make sure you run through those sections. In both the dispense checking and the blister pack checking, it's important for you to ensure two things. One, was the doctor's order accurately transferred on the system and hence printed correctly on the label? That's one. Secondly, did we actually fill out the medication as per the order? These are very critical issues. In the book, all those things are explained very well and in great detail. Make sure to take that time and solve some of the exercises that are given out to you. To be able to successfully solve a non-sterile compounding station, it's very important that you feel confident about your calculations. If they already weigh out and give the material to you, your job is a lot easier. If in the exam it also requires you to do calculation, you must have the confidence to perform that calculation quickly because time is of essence. In the book, there are some calculations which are given and are going to be particularly helpful to you for compounding stations. Make sure you try to solve them on their own. If you don't, the solution is provided with stepwise movements so that you understand how we came to that answer. Finally, sterile preparations. Though there will be videos, the most important thing that you can do for yourself is to run through all the material that you might have during your bridging program or during your pharmacy technician program and run through it. Keep in mind that OSPE 797 is becoming the new benchmark. If you do not have that material, make sure you run through the basic overview that's given in the book. Now, if you're a part of the in-class program, make sure you completely read the book, run through the CD, and also run through the various videos that are given in the book, in the CD. Come prepared to the class with the format. That means you should know what exactly is the interaction in the interactive station, the questions you need to ask, and you should be able to ask those questions in the same sequence every single time. Know your references well. If you are to look up a monograph, you should know where to find which information. Read up on sterile preparations, compounding techniques, demonstration of devices, and in the end, make sure you complete all the exercises that are provided in the book. Any questions? I'm sure you would have some questions. Email us. Email at info@solrx.ca. Thank you, and now you will be seeing some videos.